possibilities expanded, and this book was born. In writing it, I am counting on the therapeutic relationship to provide the context through which the role of the body in treating trauma and attachment deficits is explored. It is also essential to understand that this material is in no way intended as a standalone treatment or manualized approach. The selected concepts and interventions from sensorimotor psychotherapy introduced in this book, which by no means represent the full spectrum of what sensorimotor psychotherapy has to offer, are designed as an adjunct to and in support of other methods of treatment. With a primary emphasis on the therapeutic relationship and on adjusting these ideas and interventions to the needs of each client, I expect and hope that including the body in the therapy process will become viable for therapists and their clients. However, it is important to emphasize that this book is not intended to teach the practice of sensorimotor psychotherapy or to provide comprehensive instruction in that approach. It is meant to introduce some foundational concepts of this method that clients can explore experientially through worksheets and exercises under the guidance of their therapist. Therapists who wish to learn sensorimotor psychotherapy can enroll in the comprehensive trainings in this method that are offered throughout the world by the Sensorimotor Psychotherapy Institute. Although sensorimotor psychotherapy incorporates body-oriented interventions common to other somatic psychology approaches, the Sensorimotor Psychotherapy Institute, founded in 1981, has developed its own unique method of somatic psychology theory and practice informed by interpersonal neurobiology, neuroscience, trauma, and attachment research. Often referred to as a body-oriented talking therapy, sensorimotor psychotherapy blends theory and technique from cognitive, affective, and psychodynamic therapy with straightforward somatic interventions, such as helping clients to become aware of their bodies, to track their bodily sensations, and to implement physical actions that promote empowerment and competency. Within the context of an attachment-focused therapy, sensorimotor psychotherapy teaches clinicians to become interested in how the body carries the legacy of trauma and attachment inadequacies, and in how to help clients change this legacy through somatic awareness and movement. Therapists and clients alike discover that the natural intelligence of the body can be tapped as a fundamental resource in clinical practice. Clients are taught to observe the relationship between the body, beliefs, and emotions, noticing how a self-representation uttered in a here-and-now therapy moment, such as, "I'm not good enough," both affects and is reflected in patterns of sensation, posture, gesture, breath, gait, autonomic arousal, and movement. The interventions described herein actively incorporate the body, seeking to change the habits of physical action and posture that keep clients stuck in the past, and to support a more unified approach to treatment. Sensorimotor psychotherapy, interventions for trauma and attachment, explores selected concepts and techniques from sensorimotor psychotherapy in a way that traditionally trained therapists will find immediately applicable to their clinical practice. The book will be useful for psychotherapists of a variety of persuasions: psychologists, psychiatrists, social workers, counselors, and marriage and family therapists. Some of the material may also be valuable for psychiatric nurses, occupational therapists, rehabilitation therapists, crisis workers, victim advocates, disaster workers, and body therapists, as well as for graduate students and interns entering the field of mental health. Sensorimotor psychotherapy, interventions for trauma and attachment, begins with a section that presents foundational premises and orients therapists and clients to the book and how to use it. The remainder of the book consists of relatively short chapters, each one designed to educate the listener about a particular topic relevant to clinical work. A glossary of terms is provided in the bonus PDF. Every chapter is accompanied by several worksheets that are designed to help clients integrate the material. Each chapter is preceded by a guide for therapists that describes the main purpose of the chapter, identifies which clients might benefit most from it, offers tips for integrating the material into clinical practice, introduces the chapter's worksheets, and suggests possibilities for adapting these interventions with dissociative clients. Listeners are encouraged to familiarize themselves with the contents of this book and select and explore those chapters, interventions, and worksheets that are most useful and appropriate for their profession and with their specific clientele. Section 1. Getting Started. The chapters in the first section offer important background information for the topic chapters and worksheets that follow. All three chapters in this section are intended for therapists to hear in preparation for utilizing.